Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Dr. Cheryl Pegus, Executive Vice President, Health and Wellness, Walmart. Cheryl, welcome. Thank you for joining us.
Thank you so much for having me.
Cheryl, Walmart, it has created and powers a tremendous ecosystem at scale across many dimensions. Employees, customers, geographic footprint, partners, supply chain. You employ more than 1.5 million associates in the U.S., where you serve hundreds of millions of customers weekly, more than $500 billion in annual revenue. Walmart Health was created 3 years ago. Talk to us about the scope and scale of Walmart Health.
Thank you. And so the first thing that I would say is when you think of our 1.6 million associates at Walmart, one of the goals of Walmart Health and Wellness is to ensure we not only serve our communities, but also that 1.6 million associates. And why is that important? We know that these people live in these communities, and so whatever services we bring them will benefit the communities. They're also internal to Walmart, so we're hearing from them. They're telling us what the needs are in their families, and we're ensuring that everything we build meets all of their needs. And so Walmart today, we have 4,600 pharmacies, 3,400 optical sites, 35 Walmart Health and Wellness clinics. We're building 60 more just in Florida next year. We acquired a telehealth company that's across all 50 states, and it's not just virtual care for urgent care, but it's also behavioral health, the first to do primary care, the first to do teen behavioral health. And we also have an audiology business as well. And we recently launched the Walmart Health Research Institute. It is a big enterprise within that larger Walmart flywheel. That gives us an opportunity to leverage not just the footprint of Walmart and the scale, but also all of the internal execution modeling that exists in the company, and now build healthcare on top of that. And that's what we're doing.
So you talked about the flywheel, because health and wellness is core to Walmart's growth flywheel. It's more than 10% of the business. A lot of that has been so far pharmacy, over-the-counter drugs. So your piece of the puzzle, how will you drive growth and think about integrating with traditional providers in the communities you serve?
Absolutely, and the health and wellness business includes all of the pharmacies, includes all of the optical sites, and now we're building out Walmart Health and Wellness clinics. What's really important, I think, to realize is Walmart's footprint. We have 5,100 stores, 4,000 of them, Sam Walton built them in medically underserved and rural areas. And it's really important for people to hear that, because when we talk about medically underserved areas, what that means by definition is that there isn't enough access to primary care. And primary care is not just seeing a doctor. It means getting your eyes examined. It means getting your prescriptions for multiple sclerosis and for oncology diseases. It means being able to have someone help you with your diabetes and your high blood pressure. So when we think about Walmart Health, we think of building upon a tradition that began serving communities that did not have access before to fresh food. Walmart is the largest provider and the lowest cost provider of fresh organic foods in this country. And if we all believe that food is medicine, we stand in a great position to bring it to communities that do not have that today. In our Walmart Health clinics, we focus on when you come in, and what's different about us is it can be on the weekend, it can be in the evening. We're open as long as a Walmart's open. It allows a family today, as they think about prices of gas or other things, to bring their entire family into the store to shop for food, to buy their clothing, and to also get a behavioral health visit, and also get a dental cleaning, and. Our goal is to make every interaction meaningful, being mindful of your time, and making sure that we're providing you with all of the services of a flywheel that someone needs to live comfortably and happy in their well-being. And that's how we're building out our business.
Cheryl, you get into a really interesting concept here, because it's this notion of orchestrating all of these pieces at scale and aggregation, being a healthcare aggregator, if you will, right? There's this concept of payments aggregation. This is healthcare aggregation. But in addition to that, what is different in terms of the actual operating model or the experience, right? Because it's one thing to like aggregate these traditional disparate healthcare parts and maybe replicate, okay, instead of a person goes to their dentist or their primary care physician, well, let me aggregate that. So aggregation is aggregation and orchestration versus the actual operational execution and the experience the patient gets.
Yeah, it's a really, really important question. So we know that healthcare, if you did 100% and you broke that out, only 20% of healthcare is visiting a doc. We talk about that a lot, but that's not what makes up someone's well-being. 30% of that is being able to manage your personal health. If you had diabetes or you had hypertension, how are you managing that at home? Do you know what to do? Do you understand how to take your medication? 40% of that is social determinants of health. Do I have access to food? Do I know how to get the insurance that I need for my medications? Do I understand what it means to apply annually? Am I getting all of the preventive services because they're available to me in our community? And so when we think about healthcare, we do not think just about that doctor or the dentist or the optician's interaction. We think about this other 90% of healthcare. And what's unique about us is our model is built on community health workers. We have community health workers help you filling out your forms for Medicaid. We have community health workers who are helping you pick out fresh food. We have community health workers who are helping you apply for discount programs for specialty drugs for your medical conditions. So our model says the doctor is a member of the team, but your team may be led and maybe should be led by a community health worker who's from your community, understands the travails that you go through to even get access to healthcare, and is assisting you as someone who thinks there's no question that's a stupid question, and who understands how you live. So that's one really unique part of our model. The second part of our model that's pretty unique is that we offer this not 9 to 5. We are 7 days a week, open until 9 p.m. We're open every weekend. The third part of our model that's pretty unique that I think is being picked up more, it's that hybrid care. Yes, being seen in person is really important. Maybe your next visit, when we're checking on how your feet are doing in your diabetes home, we have actually someone who's in the house who is looking at your feet and taking pictures, and it doesn't have to be a doctor. The doctor is virtual and being able to manage that. Our model is really focused on how do we keep physicians from getting burnt out in healthcare? How do we give them the resources to do this really well? And then our last piece is how do we use data and tools to automate things that neither my doctors nor my CHWs should be doing. They're things that can actually be done relatively easily. And those things are, we have our Walmart app. You can come in and schedule your appointment for your doctor's visit, for your optical visit. We will keep in your records every immunization you ever had. We'll remind you to get your HPV vaccine. We'll remind you for your next. And so the things that you would think about that you have to do, but you don't have time to do, it's why people don't do it. How do we take those and get it done and not give it to the doctor's plate to do? Our model is that, I believe, transformational.
Your CEO, Doug McMillon, today said, pocketbooks are stretched. Folks want more value. How do you think about this for Walmart Health in terms of offering more value, diversification?
Yeah, it's a really, really great point. So I'll start off by saying is we have 17 million people from medically underserved areas who come into our stores every day. 90% of America came through a Walmart in the last year, 70% in the last month. And so we are not saying we have all the answers, we're actually asking them what their needs are. A couple of years ago, we saw that insulin and people with diabetes, not only were they not filling their prescriptions on time, we were seeing them stretch it. And if you asked them, they said we couldn't afford insulin. And people who need this, right, to not just live, but to prevent chronic diseases, could not afford it. And we, Walmart, decided to develop our own branded insulin at $35. About 70 to 80% cheaper than anything on the market. We believe that we have a role in bringing products like that to market because of the volume of people who come through our stores. And obviously, if that many people are coming through a Walmart, it's not because they're all on Medicaid. These are people with health insurance. They can't afford health insurance and they're not getting the right access. So we want to continue to partner to bring more affordable medications to market. The second thing that we're really conscious about is that the needs in different communities vary. We recently did a study on rural health, asking rural health physicians, first study of its kind ever done. We partnered with Medscape. And what we learned from them is they actually can get patients in to see them. What they have is an issue with being able to provide all the other things people need after they see the doctor. And so their model is they're looking for us to partner to bring community health workers into rural America. They're looking for us to provide some of the in-home services, and we can actually drone deliver your medications wherever you live. We're doing that now. And so for us, we want to take innovation and make it easier, but we also want to take just the basics and deliver it to people. If everyone in America who's eligible for a pneumonia vaccine got it, we would decrease healthcare costs by 10%, period. Those are really simple things that are measurable that we can do. Doesn't take a doctor to do it, and we're really trying to make sure that we're letting people know how easy it is to take care of themselves as part of this model of healthcare has limited resources, healthcare is expensive. How does Walmart lower cost, utilize all of our assets to ensure that we're part of the healthcare ecosystem?
So since you talked about serving so much of America and employing a lot of employees in the United States, with this type of reach, that means Walmart is an actor in the healthcare ecosystem that can drive value-based care at scale. Recently, you signed a partnership with United Health Group. Talk to us about Walmart's role and what you're doing broadly, as well as with United Health Group, in terms of getting to value-based care at scale.
Yeah, thank you for that, because this is a really important part of the work that I've been focused on in the last couple of years. What we know is that today, our current payment models that incentivizes people for when they will choose to go to a doctor or incentivizes doctors for when they will provide care is not working. We've seen health outcomes continue to decrease pre-COVID, and we've seen it worsen during COVID. So there's an incentivization model for the consumer and for the physicians that must change. Many people can say value-based care, and even if you look at the largest example, Medicare Advantage has problems. What they can't say is that the old system is the one that's working. And so what we're focused on is how in a data-driven way can we continue to improve on healthcare. If, as I've mentioned, only 20% of your healthcare comes from seeing the doctor, you've got to change healthcare so that you're treating the other pieces. There is no payment model today that pays for fresh food consistently, a CHW to help you fill out your Medicaid forms, to get your medications delivered to you, unless you look at value-based care that says, for every patient, here's what we're going to pay. You do everything you must do to keep them healthy. And so we're committed to value-based care because as a model, it allows for us to build out the teams that lower cost. Everything does not have to be done at a doctor's salary. Actually, most of it should not be done. And so we're really focused on that lowering of cost, team-based care, because we care about these clinicians, right? Burnout is not something you just talk about, it's something you do to help people not experience that. That's what we're focused on. United Healthcare helps us get there faster.
And so what does that look like practically over the next 12 months?
Sure.
The implementation plan and the outcomes you expect to deliver.
And so Walmart has our health clinics, as you mentioned, pretty early in the journey for us. When I joined Walmart, we had about 17 clinics. Over the last, 12 months, we're now up to 35. We'll add a ton more over the next couple of years. To do value-based care well, so that you get the right outcomes, you need a back end of data analytics. You need clinicians getting access to evidence-based medicine. You need to give them feedback on where the patients are and what they need. And you also need to be able to look at how you're managing the medical cost and team-based care. Optum has a lot of these tools already built. Optum is also an organization that is national in scale the way we are. And we, Walmart, need to work with someone who's national in scale as we try to bring evidence-based care to communities. I'd say the last thing is we believe that we have a partner who, like us, want to measure outcomes and look at what we're doing and publish it in peer-reviewed journals. We want to show what works. If we learn something's not working, we want to share that as well. And so a data-driven partner at scale is the only one that we can partner with for the work that we're doing. There are many other national players at scale as you look beyond Medicare Advantage. Our goal is to have partnerships based on what our communities need. We are wedded to improving care community by community, and we will partner to do that.
Cheryl, leadership. In life, in business, there are codes, norms, rules on how things are done. Where have you been a code breaker in your career or life journey, and how did you do it?
So, I've had to be a lot of firsts. And I would tell you that being first is exhausting. I'd like to stop being first. First African-American cardiologist trained at Cornell New York Hospital. First chair of the National Association of Black Cardiologists. First chief medical officer. I mean, it's just, there's a lot of firsts. We should be moving past that. And so one of the things that I'm really committed to is helping people not feel as if they're first or not even second. And I do a lot of work with a number of organizations. One, I have a scholarship at my medical school for minority and underserved students since since 2000. And so each year a student gets a scholarship. That's really important because cost shouldn't be a barrier. I've also done a lot of work in how do we ensure that we're telling the truth about what's needed to succeed, because it's work. And it's the type of work that I think you can enjoy, but you have to know what you're walking into. And so I have an incredible mentoring team around me. I call them truth tellers. They're also people who will also tell me when I'm wrong. And that mentoring team, I don't just reach out to when I'm making a decision in my career or my life. I'm in constant contact with them. Some are clinicians, some are business people, some are people who I grew up with and went to school with. And that's really important for people who can honestly say, here's what you're doing. There are a couple of other things that are really important to me as well. I really don't like negativity, and so I've got two things that I always say. There are people who talk to you, and there are people who talk about you. And sometimes we spend a lot of time on the people who talk about us because we want to convince them that we're good people, and we want them to turn and see what's great about us. I spend all of my time on the people who talk to me because they are saying, even if we see something wrong, we'll tell you. Or they're saying, we know that that's hard, but we're going to help you. So that's really important for me. And the last thing I would say is I'm always looking at how we all can work together. What we do at Walmart is absolutely necessary work. Companies that are looking at how do we look at genetics and health, how do we look at brain health, how do we look at longevity, that's important as well. Places that are looking at how do we invest to innovate in healthcare, that's important as well. Every one of these pieces are important. My goal in the way I look at things is how do I step back and not think of where I am today, but think of why did I enter healthcare? Why am I in this game at all? And it is to improve outcomes for everyone, particularly those who don't feel as if they know how to use the healthcare system. Families like mine, immigrant family, grew up not knowing how to use healthcare. I don't forget where I came from, and I want to make that better.
Cheryl, thank you so much for joining us.
Thank you for having me, as always. Wonderful time with you. Thank you.